Hi, this is Sharon Rayner. I'm going to be talking about the social determinants of LGBTQIA health. In this presentation, I'll be talking about what are the social determinants of health for LGBT people and try to understand how social determinants of health are experienced by the community and also understand how social determinants of health affect LGBT people's health, physical but mental health, and also how it impacts their access to healthcare. So, what are the determinants of health? Well, the determinants of health are defined as factors that contribute to a person's current state of health and wellness. And we talk about 5 determinants of health of a population. And those 5 determinants are number 1, biology and genetics. And so that would refer to age or sex at birth. The second one is individual behavior, such as things like practicing safe sex practices. The third is social environment, which is where we talk about discrimination, income and economics, and gender. The fourth is physical environment, where people are impacted by their neighborhood, things like crowding, air quality, access to healthy food, public transportation, parks and recreation, for example. And the fifth one is health services. So having access to inclusive care, having health insurance, and having access to quality health care. So social determinants of health are really complex, overlapping, and integrated social structures and economic structures that are responsible for most health inequities. In the social determinants of health for the Healthy People 2030, the social determinant of health wheel shows how all of these aspects, all of these factors such as education, access and quality, economic stability, healthcare, access and quality, and neighborhoods or the built environment, and then also the social context, how all of these are the factors that make up the social determinants of health. One way to think of social determinants of health are sort of like exposures, which then lead to symptoms of the underlying disease, which is health disparities. So social determinants of health are shaped by the distribution of money, power, and resources throughout local communities, nations, and the world. And when we think about resources and the scarcity of resources and how they are distributed, that's the politics. So politics will influence the social determinants of health. And all of these will contribute to health disparities. And that is the disease that we see within our health system. Some more specific examples of health disparities are social and economic disadvantage, negative effect, they negatively affect certain populations, such as the LGBTQ community, and they present obstacles and barriers. And also discrimination or exclusion, such as this discrimination or exclusion based on race, ethnicity, religion, socioeconomic status, gender, mental health, sexual orientation, or geographic location. Specific to the LGBTQIA health, these are some examples from more recent literature that shows that lesbians are nearly 3 times more likely to be obese or overweight than other women. They have, the LGBTQ person may have lower rates of preventive cancer screenings. Gay and bisexual men, transgender women are at higher risk for HIV and other sexually transmitted infections. Disparities intersect with racial, economic, and ethnic disparities. So, for example, Black, lesbian, obese, and diabetes all are combined to have a more impact on an individual. And 70% of trans people report being refused medical care, flat out refused care. And that was from a study that I'll have the reference at the end. And that was pretty shocking when I read that. And then health providers they've also said that health providers have been rough or abusive, and that in the medical realm, wear gloves and when delivering care, when they're not really needed, and just because they fear touching the person. As a population, transgender individuals experience a higher prevalence of HIV, sexually transmitted infections, hate crimes, behavioral health issues, and suicide. They have difficulty accessing preventive and urgent care. They're less likely to have health insurance than heterosexual or lesbian, gay, or bisexual individuals. And older LGBTQ individuals face additional barriers to health due to isolation, less family support, and a lack of social and support services. Poverty is another big, has a big impact on transgender people. Poverty and discrimination. 30% of transgender individuals have a lifetime, are homeless in their lifetime. 15% are unemployed. 29% live in poverty, and that's versus 14% of the general United States population. And LGBT people, and especially transgender people, experience housing discrimination. LGBTQIA people experience violence more often than their counterparts who are heterosexual, and are more likely to be targets of hate crime. Gay men report being victims of violent hate crimes at a higher rate than any other targeted group. And transgender women, Black LGBT people are vulnerable to both verbal harassment and physical assault. A couple examples of health consequences that have been shown to be directly related to social determinants of health are people are less likely to seek emergency care, and they're less likely to seek out routine or preventive care. And so how can we, as healthcare providers, mental health providers, address social determinants of health for LGBTQ people? Well, first of all, we can provide care that acknowledges the social determinants of health, and learn to ensure that our personal practices address trauma that LGBT people experience, and really that all people experience, and provide affirming environments which offer care, not just symptom management, but real care that people can expect and trust. And then work towards policy solutions that support minority and vulnerable populations that are impacted by health disparities. And these are my references. Most of the information is from the Healthy People 2030 and moving towards equitable health and well-being in the United States.